Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. Welcome to the Granite List Live. I'm your host, Sally Pace, and today I'm joined by Alicia Riedel. She is the immediate past president of NABIP, and she is also a consultant for large employers. Alicia, thank you so much for being here.
Thanks for having me. I really appreciate it.
We're so excited. And you've got a very interesting background because not only have you spent more than 2 decades in the benefits consulting arena, you grew up in this industry.
I did.
I'd love to understand kind of how has that background shaped the way you view today's benefits challenges? Tell us what you've seen.
Well, I grew up, like you said, in the industry, literally. So my family ran a small benefits agency in Minnesota. Before that, my dad worked in the industry in life insurance and in benefits. So I really saw early on how benefits affect people's lives, how important they are. And later I spent, like you said, a couple of decades consulting with small employers, large employers, and now mostly Fortune 100 companies. I also worked for carriers. And as you've seen through my NABIP work, I've been in leadership both locally in Minnesota and then nationally through the organization to represent all agents, brokers, and advisors in our industry. So I would say that range all the way from like the kitchen table conversations that you have to C-suite strategies, it really does shape how I see today's challenges. We have a lot of innovation going on right now. Unprecedented along with that, though, is the complexity and, to your point, Sally, the fragmentation with what your company does. And so with inflation around pharmacy, with GLP-1 cost pricing pressures, with opaque pricing, claims processing failures, network variabilities, patients not being able to navigate their way through not only their benefits, but the provider system, it's unsustainable. And that's so why, for me personally, I always try to come back to kind of that fundamental access, the affordability and the quality, and trying to create an experience for real human beings that are trying to use the system to help them a lot of times in some of the worst times in their own lives.
Absolutely. You have had the experience as boots on the ground working alongside various brokerages, employers, certainly with plan members themselves. So can you share what trends you've seen that really do signal some of the biggest shifts in how people are engaging with their benefits?
Yeah, well, I think the first big shift right now is expectations, right? So people want to work within their benefits and in their interactions with the healthcare system like they do the rest of their lives, whether it's mostly on demand, personalized, and clear. They don't want a 60-page PDF. As a matter of fact, they don't want a 2-page PDF. They want guidance in that moment when they need it. And then I think people are using benefits beyond the normal network or geographical boundaries that we've used for almost all of humanity. You go to the doctor that's down the street, et cetera. Now we have virtual care, we have centers of excellence, we have medical travel. All those things have become much more normalized, especially as people realize that the contracted rate that your carrier has is not always the best rate. And many members now discover that self-pay bundling or getting a direct primary care provider might actually be more transparent and affordable than the plan that they have for their benefits, which I think is a sad state of affairs. And then I think a third shift, again, Sally, this kind of goes to your company, is point solution fatigue. And so for years, the answer was, let's add another app, let's add another point solution for whatever, diabetes or heart disease or losing weight. And now employers are juggling multiple vendors and employees are so overwhelmed. This year at the national conference for NABIP in Miami, we actually had some employers on stage. I helped answer some questions with them in a panel. Medtronic was there, Miami-Dade Schools representative was there, and we talked about juggling all these vendors and how difficult it is to get people to even understand what their deductible is, let alone being able to figure out how they access these solutions that really could help them. And so integration, navigation, and front door solutions are really where the coordination needs to happen and where we're seeing companies step up. And then I think finally, right now, anyways, and I personally have done this for myself, for my husband, for my mother, for my children, is using AI to understand your own symptoms, interpret your labs, build basic healthcare literacy. It's a powerful tool when used appropriately, but it also highlights how confusing the traditional system can be. And where providers are in using AI and carriers is in a totally different realm than how patients are trying to use it.
Mhm.
So I think it's helping, but it's creating confusion as well.
Absolutely. At the Granite List, we're also big fans of the work that you do, and you've been published and been the face of the organization for a while. And I know that some of the core themes you've championed are access, affordability, and quality. So I'm curious, which of those feels most under pressure right now, and what can benefits leaders do to make meaningful progress there?
Yeah, I think, affordability gets the headlines, but access is under the most pressure. I think a benefit is only meaningful if someone can actually use that benefit, understand it, and get to the right care in time. And so I'm speaking specifically for employers here as I think about access, affordability, and quality, because that's where I work right now is directly with employers. But strong primary care and navigation are one big area that they're focusing on. Advanced primary care, direct primary care models improve access, shorten wait times, reduce avoidable ER. When primary care is a relationship instead of a transaction, everything improves. And then for me personally, I went through a health scare a couple of years ago, and my husband's employer, Wells Fargo, had included health, which has second opinion, and they have the ability to call them instead of calling the insurance company. So that's one example of where some of that first sort of navigation support can help. It's not perfect, it could be much better, but I think that navigation in primary care is one area that employers are really focusing on. Pharmacy strategy, obviously, GLP-1s, specialty drugs, gene therapies, they require thoughtful design, clinical pathways, and cost management. And pharmacy is now the main engine of trend. And so I could go on forever about this topic, but it's how do you help employees and members understand the drugs they're taking and making sure they're doing it correctly and that they're paying the least amount that they can to access this drug that they need, but also what are the employers and the carriers and the PBMs and the those sorts of entities doing to ensure that it's not just about cost, it's about making sure that your strategy is providing the best care and outcomes when you're covering these drugs. And then lastly, I think transparency and fiduciary oversight. So employers are realizing they are fiduciaries, not just purchasers. Cases like the New Jersey versus Horizon lawsuit, which proved the insurer failed to secure the best available price on claims, highlight how hidden pricing directly harms both employers and members. And so when transparency breaks down, patients pay more. And so just providing an app or a way for somebody to look at the pricing that they're going to get before they go in, that's one big step. But there's a whole nother level there of, is it cheaper for me as a member to self-pay or do bundled pricing or do medical travel? And I think members and patients are actually ahead of the system in that because it is so opaque. So access and affordability equality, only move in the right direction when they're tackled together, not in separate buckets.
Absolutely. You have definitely hit the nail on the head with access and affordability. Another pain point from healthcare in general is this interoperability. And it's a big issue across the entire spectrum. So, from your experience, are there any practical steps that employers or vendors can take to make that data and coordination less fragmented for members?
Yeah, there is. I'll start with a really quick story of my own. My mom spends a few months a year down in Florida and then up here in Minnesota with us the rest of the time. And the system that a lot of providers use is Epic. Doesn't matter where you are in the country. but the way that they set those systems up determines what information is available at the time somebody's seeing a doctor. So meaning like a health system here in Minnesota could set up their system so that another system doesn't have direct access into it at the time of service or that somebody's actually seeing a patient. And so my mother went to the ER and then was put inpatient, and I was doing my desperate best to help her because they didn't have her medical records, even though both systems used Epic. And my mom was not in a place where she could actually communicate the things that were going on with her in her past. And so by the time I got down there, they'd already made a couple of mistakes on medications. They'd already done things that didn't necessarily hurt her, but weren't helping her. And then I even realized that between the ER and the inpatient, her medical records weren't transferring. And so the inpatient care was not even being coordinated with the ER care that she had gotten. And so that's just one example of how our fragmented system really can be life threatening to people when they're in situations. So I think interoperability sounds like a technical problem, but I think it's really more of a coordination problems. And so employers can drive progress by mapping the actual member journey to identify where fragmentation causes delays or denials. They can prioritize partners who are built for integrations and do open APIs and share their metrics. And they can require vendors to define common outcomes, not sliced engagement metrics. And so transparency rules, price posting regulations, emerging data exchange framework like TEFCA are raising the floor, but employers still need to demand coherence. The New Jersey versus Ryan case also reminds us that interoperability and transparency aren't academic. They directly affect claims accuracy, the pricing, the fiduciary compliance, and the trust that the employers, the providers, and the patients all have in the system itself.
Well, I am certain, having never met your mother, that she is beyond grateful to have you as a daughter. But unfortunately, not everybody has an Alicia as a daughter helping, or a sister or best friend to help through this crazy journey. So as you think about how patients and plan members are moving between providers, states, or as you alluded to, even countries, are you seeing new tools or strategies that you think will actually improve that continuity of care?
Yeah, I think continuity of care, it really can mean a lot of different things. So it could mean across providers, it could be across states, it could be across countries. So in my own personal life, with example with my mother or all the rest of the people that I love in my family, we've all personally started to use AI and use a centralized way of keeping track of our own medical records and a summary of what's happening. So just I think I put that out there as a tip to everybody that you are your own best advocate, or the people that you love are your own best advocate. And while we're waiting for the rest of the system to catch up and provide this interoperability, it's continuity of care, at this point, unfortunately, people have to take control of that. So that's advice that I would give. Things that do help, I think, is navigation that follows the member, not the plan year, portable records and shared data pathways, which a lot of employers are trying to figure out if they can put in their contracting ways that this transparency and this shared pathway follows the member. And then I think centers of excellence and medical travel programs where pre-op, procedure, and follow-up are fully coordinated, right? So like again, my mom's in the hospital in Florida, her primary care provider's in Minnesota. The only way that they knew that happened was by Alicia sending a note to the primary care provider. And so, that is why it's so important that employers are thinking about the contracts that they have, or if they're doing direct contracting, what they're requiring of those providers to actually make sure that they're following through, with their patients.
Yeah. And that, talking about your mom's health journey makes me think about my own parents. And I think, we come from a generation that was trained not to question, particularly in the healthcare space. And so it is interesting to see that generation above us starting to take our lead and say, no, I can't ask questions. I can't, you're exactly be my own advocate, because nobody else, unless they have a daughter in the business or son, is going to do it for me. So just thinking about what all you've seen up to this point, I know you do not own a crystal ball, but if you did, and you were looking ahead, what changes or emerging trends do you think are going to disrupt our industry in the next couple of years, both for better or worse?
Well, first of all, I want to add one more thing to what you just said, because it is interesting being in Gen X, a younger Gen Xer, and having my parents, well, my dad passed away, but my mom on one side, and then my children who are in their 20s on the other side. And so there's actually an education that I've done for both.
Hmm.
And I think in addition to helping our parents understand that they can ask questions, that it actually is a good thing. And if the provider doesn't like it, then maybe we need to find a different one. But it's also having a conversation with the Gen Zs or the really young millennials about you can trust your doctors too. And like there is a point at which you can bring skepticism, research, and your own kind of understanding alongside those that have the training to be able to support your journey in health. And so to me, it's a really crazy place to be, being a benefits consultant and thinking about it, but also just being a woman,
Hmm.
who has family that I'm trying to help sort of bridge the dysfunction that's happening in our healthcare system. But trends, I think some of the trends I think about, pharmacy and GLP-1 economics is reshaping budget, it's reshaping benefit design and contracting. We talked about AI enabled navigation, personalization, so real time risk detection. So employers are looking at that when they're looking at their claims, and smarter triage, lab clinical support. It's really looking at how you're going to simplify care, not create new confusion. I think fiduciary expectations for employers is actually pushing more transparency, because if the employer is going to be held accountable, their partners better be giving them the data that they own and to make those decisions. I think precision medicine, so the shift towards genetics, biomarkers, targeted therapies is clinically powerful, but financially destabilizing if not paired with strong benefit design. So these things are needed and they're amazing, but if we don't figure out a way to design the benefits to pay for them, it could destabilize our system. And then probably moves towards transparency. So as pricing becomes more visible, as employers are questioning whether their rates and their claims are, best practice, best value, and litigation that is just snowballing now, whether it's fiduciary or it's the New Jersey Horizon lawsuit, that these assumptions that employers are rely on are not always accurate, and you have to do that digging. And then I think the last thing I'll say is consumer driven demand for clarity. So members really, and employees and patients are pushing for clarity on all of the interactions that they're having with regards to their benefits. And they are making choices to do things directly because they're not getting answers and transparency from the traditional system. So going back to cash pay or direct primary care or medical travel, et cetera. So I think clarity, coordination, and predictability are really becoming the new standard. And it'll be really interesting to see how the established ecosystem reacts to that.
Yeah. Well, another trend that is, and I want to kind of end our conversation with this. The other great trend I think we're seeing from where you sit, from where I sit, is this resurgence of young folks back into
Mm.
the industry and in the benefits world, which is really exciting because that means that our professions are not dead to them. They do care. I'm curious for those listening that are, say around your children's age, what guidance would you give them about building credibility and being adaptable in this crazy field that we're in?
That's a great point. As I think about it, I think the first thing I'll say is if you're not an empathetic or compassionate person, you know, I mean, this is just my personal opinion, your impact on people and on the job and the companies that you work with is diminished quite a bit, because, my work as a carrier rep working in member services when I was in my early 20s has stuck with me and makes me really understand the person behind the claim, the person behind the design. And so don't ever forget the person. Don't ever forget your mom or your child or yourself, and how you are the one and they are the ones that are affected by the strategies that you're helping put in place, et cetera. I think the second one that I would say is super important, and unfortunately a lot of people struggle with this, is learn the whole ecosystem, not just the role you have in it. So especially if you're going to be a consultant or a broker, if you understand insurers, providers, PBMs, navigation vendors, employer contracting, you're going to be a much better consultant, and it becomes a lot more interesting. You already said it, be curious and adaptable, right? The playbook is evolving. I can tell you in the last 5 years, things have changed more than they did in the 20 years before that when I was in this industry. And so that's maybe why Gen Z is attracted to this right now, is because it is very exciting, but it also means that you have to be willing to be open to change and to reevaluate what you thought even a few months ago. Show up in those hard moments. Benefits is a trust business. And so building credibility is by helping people during their crises, not just during open enrollment. And maybe last, because this scares me, and I use this a lot, but AI, use it responsibly, use it as a tool, not as a replacement for critical thinking.
Mm-hmm.
It can enhance your research, it can enhance your communication and comprehension, but AI right now is built to, I think, build into your own biases. And so if you don't challenge yourself in those AI interactions, you might really be missing out on the learning and the adaptability that we were just talking about. So I think that's, for me, kind of the things that I would tell people. But most importantly, I think it's, again, just remember, this is about people. This isn't about numbers or actuaries or networks or tools. This is about people really trying to get the care that they need, and what you do matters in that equation.
I think that's a perfect note to end on. It's a reminder for all of us, no matter what role we have or how long we've been in the industry, is that it comes down to the individual. It comes down to the individual, and it does matter how we treat them. So, Alicia Riedel, you have been a phenomenal leader in our industry. I'm sorry that you will have turned over the reins and are immediate past president of NABIP, but we loved watching your journey and your career path so far, so we will continue watching. And I can't thank you enough for being on today's show.
Well, thank you. This has really brightened my day here in cloudy Minnesota at 40 degrees. I feel a very big warmth coming from you, and I appreciate the kudos. And it also is great to talk about it because it reminds me what I just said, which is it's about people. So thank you for having me. I really appreciate it.
Absolutely. And I want to thank our listeners for tuning in to another episode of The Granite List Live.
Thank you for listening to this episode of The Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.